Paul Levy, taking charge of Beth Israel Deaconess Medical Center. Hello, my name is Ari Branstein. This is a project for my class, Public Management, for the University of Massachusetts Dartmouth Public Policy Program. The goal of this presentation will be to analyze the management lessons that can be learned from the experience from the Paul Levy taking charge of the Beth Israel Deaconess Medical Center case study. Because of the lack of places that Jewish doctors could practice, Beth Israel opened its doors in 1916. The hospital was located in the Longwood area of Boston and quickly grew to being a well-established hospital known for research, teaching, and its great patient care. Beth Israel was known as having a more casual management style, emphasizing professional autonomy and creativity. Close by, the New England Deaconess Hospital, founded in 1896 by Methodist deaconesses, had its own notoriety as a hospital known for surgical specialties. Deaconess was known for a rule-based, top-down management. In the early 1990s, there were talks of a merger between Beth Israel and the Brigham and Women's Hospital. That plan was off the board when Brigham and Women's merged with Massachusetts General Hospital to form the Partners Group. In fear for a failing market, Beth Israel ultimately merged with Deaconess Hospital in 1996. These two hospitals and a few others became the Care Group system. Both staffs were very loyal to their parent organizations, and many employees were anxious about giving up their hospital's culture and values. It was apparent that Beth Israel appeared to dominate the Deaconess employees. The two hospitals needed to find a way to overcome the drastic cultural differences. The Partners merger focused mostly on administrative changes and efforts to keep their differently cultured hospitals continuing to perform well. Care Group, however, took a different approach. The new Beth Israel Deaconess Hospital was run by Mitch Rabkin from Beth Israel. Employees from the Deaconess Hospital felt threatened and hostility grew. Although Beth Israel and Deaconess had a differing approach on the observation and treatment of patients, they still tried to integrate the two together. Poor business planning and implementing led Beth Israel Deaconess to have annual losses over $50 million by 1998. Consultants were brought in to help assess the hospital's problems, but anything that was reported was pushed back by the staff. The staff felt powerless, lost interest, and ended up seeking other employment. They had a serious lack of teamwork and were frightened by financial collapse. Paul Levy said, "This was not a question of not knowing what to do. Everyone knew what had to be done. This was an absolute failure to execute, which ultimately is a failure of leadership and of governance. The board of directors did not have its hands on the pulse of the organization, did not set clear objectives, and did not hold management accountable. The ultimate issues that the hospital had were not about the health care of patients, but rather problems with management and in the business of the organization." In comes Paul Levy, a professor with 3 degrees from MIT, who has headed the State Department of Public Utilities, the Massachusetts Water Resources Authority, and the executive dean for administration at the Harvard Medical School. He's known as a good negotiator and someone who likes a challenge. In January of 2002, Levy became the president and CEO of Beth Israel Medical Center. Paul Levy's leadership style helped correct the failing Beth Israel Deaconess. Paul Levy said the strength of an organization is measured not by counting the number of successes, but by its response to failure. We have made an institutional commitment to eliminating harm, and that requires sharing information about cases such as this so that we all have a chance to learn from it. We still have more to learn from this case and changes that need to be made, and so we will be providing more information in the future. Levy took the job as a public service. His management approach was one that people wanted to do well and wanted to do good. Levy created an environment where they can succeed. Levy trusts his people and realized that people make mistakes, and not from incompetence, but from a place of insufficient training or a bad environment. Levy made it clear to the staff that his goal for the hospital was to continue supporting its core value of retaining and maintaining the reputation of the hospital as a warm and caring place in the community. He then made sure that when he came to the hospital, any plans that were discussed were actually implemented. This is something the hospital was unable to do in the past. An independent company, the Hunter Group, came into Beth Israel Deaconess to assess the hospital's organization. Levy made it very clear that he would use this report to create his plan for change. As the leader of the hospital, Levy didn't back down from the acquisition of new partners. Levy headed the acquisition of the Glover Hospital in Needham, Massachusetts. He showed the staff and the community that he was taking charge and taking advantage of good business deals. He wanted to show the staff and community that the hospital was not going to be sold to a for-profit, but instead it was expanding. Levy came into Beth Israel Deaconess with the goal of turning around the organization. The organization was threatened by the Attorney General to be sold to a for-profit organization. The hospital was losing millions of dollars that were supposed to be for new technology. This threat led Harvard to say that they would remove their academic affiliation. The loss of Harvard's academic affiliation would create a lot of employees to seek other jobs. When Levy joined the hospital group, he was determined to create a plan within a month. He wanted to show the staff and the community that they could turn the hospital around. He knew it wouldn't be an overnight change, but he wanted to create the expectation for the staff that within a few years, their losses would be drastically cut. There was a lot going on at Beth Israel, and there were several interested parties. Unfortunately, these interested parties were also some of the reasons as to why the hospital was failing. All of these groups had several different points of view. Even after the struggling hospital was publicly known for losing over $50 million a year, the chiefs still referred to the goals of the hospital as Mickey Mouse. Levy was able to manage the Attorney General, the care group system, the CFO, the COO, the chiefs, the nursing staff, and the rest of the support staff. He was able to create communication with all and assess the changes needed for all of them. Levy made it very clear to the staff he wanted to hear from everyone. He took time from what he was doing to meet with all of the different groups of staff. Levy ultimately realized all of the staff was similar. They wanted to know what was going on, what would be done, and if their jobs were safe. They wanted to be part of the conversation. The change process was not an easy one, and was actually very hard for some staff and their families as an inevitable layoffs occurred. Levy, however, was able to find a way to keep the hospital moving forward. One way he was able to get the staff to move forward was by creating a sense of urgency. On Levy's first day, he sent out an email explaining how the sale of the hospital to a for-profit company was being discussed. He also discussed how this would end its academic portion of business. To any staff members who were resistant to change, the thought of them losing their jobs or becoming part of a company only interested in the bottom line forced them to begin thinking about the change. On January 11th, 2002, Levy posted on the intranet about what a private consulting firm reported about the hospital. Although he received close to 300 emails and suggestions, he responded to every one of them. He made it a priority to the staff that a plan be devised off of this and be made clear that to everyone that change was coming. On February 1st, 2002, Levy fired or laid off 150 people. Employee morale was down already about the fear of change, but now there was a fear of employment. Levy emailed the entire staff to show his commitment to the change and to help those employees hurting. He made it a point on various occasions to meet with staff members of all different levels. He wanted to get to know these people on a personal level and listen to their perspective. He called himself a cheerleader, someone who had to consistently keep cheering people on and raise morale for the positive change he was trying to create. Levy realized that all staff can be engaged with the financial goals of a healthcare institution and participate in setting operational goals. Levy's communication was, in my opinion, one of the reasons he was able to succeed. One of the greatest qualities of Levy's leadership was his transparency. He made it a point to be open and honest with all of his staff members. He told everyone the truth as to what was happening and what his plans were. Levy wanted to make sure he took time to get to know everyone on the staff. He wanted to listen to what they felt were the problems and actually look into ways to fix them. Some examples were the surgeons and the nurses. The surgeons found it hard to have the chiefs as a communication board, as they were ineffective communicators. The truth of the chiefs, as Levy explained, was that they were never chosen for their ability to be administrative leaders. They were top scholars in their academics, and that's why they were picked. As a result, Levy created the kitchen cabinet to get a chance to have FaceTime with the surgeons and hear what they had to say. With the nurses, Levy understood that they were key to retention. He met with them to find ways to improve the workplace, professional practice, the environment, and recruitment. Levy created these steering committees to get ideas from support staff and not just from the chiefs. Before Levy, the hospital tried to increase the volume of patients instead of trying to cut costs. The hospital was never able to realize this, that they were losing the money on each patient. Multiple times, the organization would also try to come up with plans to help the failing hospital. In 1999, Beth Israel Deaconess announced that they would try to go head-to-head with other area hospitals, sign a large collaboration agreement with a pharmaceutical company, and sell surplus real estate. All of these ideas were terrible, as they didn't have surgeons to compete with other hospitals. They weren't equipped to negotiate with pharmaceutical companies, and they were never able to come to a clear conclusion of what to do with the real estate. When Levy was hired, he didn't do anything drastic. He made wise decisions from an objective perspective. He listened to all sides. He made analytical decisions, and he gained trust and support from a staff who was in fear for their futures. He did all of this honestly and openly. Levy was a leader who came into the hospital from an objective and independent perspective. He was able to see the organization for what it was, a place with no communication, no real leader, and no future. His ability to create an environment where change was actually capable of happening from a group of people who were stuck in their ways was one of the best qualities of Levy's leadership. Levy was not afraid to fire people, force new policies, and create new positions. He backed each and every decision he made with transparency and truthfulness.